Parents usually would bring their children to the office complaining that their child doesn't walk normally. They would say that he or she walks with their foot tilted inward and that they look funny when they walk. Other symptoms would be that their child falls often and that every time they go about running or walking quickly, they would trip on themselves. This is a common condition. We call it intogate. And the reason it happens is because of the position of the child or the infant in his mother's womb. What would happen because of the position in the womb, the tibia bone, which is the lower leg bone, would be forced inward a little more than it should be. And when the child is born, their feet would look as if they are tilting inward. This condition does not go away in 1 or 2 months or even 1 or 2 years. Usually takes many years for the child to grow out of it. The concern with it is that while the child is growing or trying to grow out of it, they are developing the symptoms of falling and tripping and injuring themselves. Sometimes this condition would also trigger a flat foot, which would cause them pain and discomfort when they're playing and running and jumping in school. The treatment for this condition usually is a custom device called gait plates. What the gait plate does is it goes in their shoes and it forces the child's leg and foot to be tilted outward. And when their feet are tilted outward into a more normal position, usually the tripping and the falling and the tiredness subside. These gait plates are custom devices. Usually we would take a mold in the office of the child's foot. It gets sent to the lab makes them the device. Then you would bring them to the office. We would measure it against their feet, make sure it fits properly. We would measure their foot size to make sure they're wearing the right shoes and that device is put into a properly fitting shoe. And as soon as we put it in the shoe, the child experiences relief of pain. They're not tripping and falling as much, and they are able to function and play and run without any concerns. The condition itself, normally most kids would outgrow it by their teen years. The purpose of the gait plate is mainly to help them while they are growing out of the into.